afternoon, everyone. This really warms my heart to see so many of you in this room. My favorite part, for those of you who I have been speaking with frequently, some more than others, my favorite part is engaging with all of you and sharing with you new initiatives, new programming, what campus happenings are happening on here. Sorry, I ran up here because I realized the time, so now I prepared a slide. One of the things that I just kind of want to frame before I continue going on with my presentation, many of you remember me reporting at May's resident council meeting a year ago, talking about our new strategic plan, right, Gail? It's a 5-year plan. The board unanimously approved it. We worked hard with the board of directors, our strategic consultant from DeArmond Consultant, her name's Michelle Holleran, and my amazing executive leadership team. Some of you are here, raise your hands, who's here? Okay, you get perfect attendance, good job. Can't do it alone, but together, we put together a very nice strategic plan based on our current resident needs, the new incoming resident that's going to be joining us over the next, actually they're coming in now, and we've got baby boomers coming in by the thousands on a daily basis. In 5 years, 1 in 20 United States Americans will be over the age 65 and older. That's 20% of the US population. We also did some market analysis for the Rockford, Northern Illinois area. That's going to go up to about 38%. We're going to have a lot of us baby boomers, and now Gen Xers coming in. That's my generation, the forgotten generation. A lot of us are going to start thinking about where we're going to move in when we start to retire. So I'll take it into consideration, all that, plus our community here in Northern Illinois, taking those residents that might need senior care or senior services, but don't want to move to a community. We have many of those that just want to age in place, age in their own home. So they're going to need services as well. Now, that in mind, just wanted to set that. As you are aware, Jenny, what do I do? It's not working. Okay, where's my IT department? All right. Jenny, go to the first slide, please. Yeah, you're laughing at me. Can you go to the first slide? It won't work. And you know, one of my strategic initiatives is investing in technology. What the heck, guys? Some of you remember that we worked hard with our board and our executive team members to come up with a new vision statement. And I shared this with you a year ago when I addressed you regarding our new strategic plan. And our vision statement, I just want you to see it. We inspire the well-being and life journey of those who live and work in our communities. That includes my team members, all of you, and those residents that live outside of our communities as well. So this is our new vision statement. Next slide, please. We have 3 strategic initiatives. Did many of you receive the Journey Report last year, 2025? I listed our strategic plan, and I talked a little bit about how excited I am. The board agreed to 3 initiatives. Now you think, boy, they took it easy on you, Francis. They only gave you 3 initiatives to work on over the next 5 years. Where these are what we call BHAGs, big, hairy, audacious goals. But I'm proud to say that we're in our, 9 months now, Brett, of our strategic initiative. Our fiscal year begins July 1st, goes through June. So beginning July 1st, we started rolling out some of these initiatives, which many of you, it'll click once I go over a few of these. But just take a look at those. I'm not going to read them all, but I am going to go through the sub-strategies that are under each initiative. So go to the next slide, Jen, please. So fostering a whole person wellness through integrated and brain health strategies. We came up with 3. Cultivating a culture of well-being. And we kind of took this to heart because what we see well-being, we want all of you to be healthy. Not just physically, but mentally, spiritually, emotionally. Well, who's going to take care of us? We're going to need our clinical staff. We're going to need housekeeping, maintenance, dining. We all love the food here, right? We want our team members to also be healthy. So healthy employees, better atmosphere, better care for all of you. So one of the initiatives that my head of HR, Stephanie Cortez Cruz, she's right here, one of the ones that she's working really hard on is cultivating this culture of well-being for employees. We want to engage employees in communicating with us, checking in. How are you doing? Is everything going okay? How can we do better? How can we serve you better so that you can be healthy and you have all the tools you need, all the equipment you need. You're okay with your own personal well-being. And what we started working on with Stephanie, go to the next slide, please. With Stephanie's, thank you. You read my mind. Stephanie started gathering data from our employees, and she engaged the software Motivosity. Motivosity is a software platform strictly for employees, much like Wellzesta and MomoMate. Motivosity is for employees, and she has gathered some data the first quarter, and I wanted to share that with you because I thought it was important so you can see how it ties into our strategic initiatives. She asked 5 questions. Do they feel connected to coworkers? Do you feel you have a positive relationship with your manager? Would you recommend Wesley Willows as a place to work? Do you agree with and live by our company values? I was happy to see that was up 12%. And would you stay at Wesley Willows even if you were offered more pay somewhere else? More pay somewhere else, and 50% said they would stay here. I thought that was incredible. Up 18% from the prior survey that Stephanie did. So what is Stephanie and her team, what are we as a leadership team doing to continue this momentum? We're encouraging every team member to share their voice. And many employees are very timid, some of them are very young, they don't want to go to their boss or to HR. So utilizing this Motivosity application, they're able to just share their thoughts on this app. And Stephanie keeps tight tabs on that. So we're very happy to continue to support our staff on their well-being and to increase and improve staff retention. I think Stephanie has done such a great job that I want to share this with you. Wesley Willows was recognized by Senior Care as we're one of the best places to work in 2026. Senior Care Activating Insights. Thank you. Again, we're trying to create that culture of well-being, of feeling part of our community. So kudos to Stephanie. This came hot off the press last week, and we are very happy. I think you are the first to see this. We're gonna be posting it on our website as well. So very happy with that. Congratulations to Stephanie and her team. Keep up the good work. Okay, next slide. Oh, this is just an example of the Motivosity software, the application that the employees use. They ask 5 questions. This is the one that I was referencing. Also, ENPS. What does that stand for again, Stephanie?
Employee Net Promoter Score.
Employee Net Promoter Score. So that one is up the highest, where I tell my friends they should work here. You can go to the next slide, Jenny. I thought that was my timer, that I was up. All right. The second initiative was to develop an integrated healthcare system. Some of you have shared with us, with me personally, I don't know if you're in this room or not, but you've shared with me that you have no plans on moving out of your home, whether it's your suite here, whether it's one of the homes on the west side or the east side. He said, Frances, I really want to age in place. Now, some of you have said, nope, not me. I want to go where, I could get more clinical care and more nursing care. And it's okay. I mean, this campus alone, we have almost 700 residents. Every resident is going to have a different preference. But many of you have shared with me, a large percentage have shared with me that, nope, you need to figure out how to keep me healthy in my home as long as possible. So I heard you, and we are working on that. We conducted a survey. Is Jessica here? Jessica. I want to give a shout out to Jessica because this is her initiative. She is leading the charge on developing an integrated healthcare system, and she's done a very nice job. She conducted a resident survey from February 23rd to March 7th. She has some of the results, and that's how I was able to share with you that many of you said, yep, no, I'm all for you developing an integrated healthcare system, bring services on campus, open up a clinic here. I don't want to have to go anywhere else. So I heard someone say that's right. So Jessica has done a great job. She put together an integrated healthcare planning committee. And this committee consists of some of the members of the leadership team, which are nurses as well. Jennifer Elmer, who's our new VP of Community Operations, is on that committee. One of our board members, Dr. Joe Gary, who many of you know, he's a gerontologist who runs the UIC department here in Rockford. So he is the committee chair. So we're very fortunate to have him and his experience. We also have some members of the community that are also part of this committee. And one of the things, based on working with our committee, working with assessing some of the resident survey feedback that we got, was developing this tiered care model. I really can't share a whole lot with you because it would probably take the rest of the day, the rest of this meeting. But Jessica does have that in a draft format. She has shared it, developed it with the Integrated Healthcare Committee. And the different tier models, I can give you high level. Do I have that, Jenny? Didn't memorize it. All right. So in order for us to know what type of a clinic we can create, or what kind of an integrated healthcare system we can develop, we need to know who's going to need what. So this tiered care model approach is divided into 3 different layers, I'll call them. The tier 1 is your preventative services, wellness clinic, televisits, preventative screening, such things like that. Tier 2 would be specialty and intermediate support services. Do we have some behavioral or mental health services that'll be needed, orthopedic services, care management or having to navigate coordinate your care, things like that, therapy services. Tier 3 is more for the higher acuity and the complex care services. For example, someone needs us to help them with hospital coordination, wound management if someone develops a severe wound, emergency response and acute support. So as you can see, this is why this is still in a draft format. All these tiers require a lot of thought to be put in. We need the right partners. We need to partner with the right doctors. We need to partner with the various hospitals that are in our area here, nurse practitioners. So that's as much as I can share with you. I can tell you that out of all of these initiatives, this is probably the one that is going to take the most time, and I can tell you Jessica's doing a great job. She's a straight A student. We've also assigned dates for or KPIs, timelines to accomplish this, and I can share with you that all of my team members are either on time or ahead of schedule with rolling out these initiatives. Okay, next one. Oh, this is a lot of wording here, but I can put this with you, share this succinctly. Many of you know who Leslie Williams is? Okay. Do you remember how I started earlier saying that we also want to invest in the well-being of our employees? Well, Stephanie and her little daughter are sick today, and I was going to have her cover this a little bit more because she could do it more justice, but because we encourage employees' well-being, we told her to stay home and take care of her daughter, so I'm going to do my best here. What Leslie has been doing, and many of you, I think I know some of you in this room have already met with her on a few occasions, but one of the things that I'm very proud of that she did is ensure that a lot of our most of our well-being team members get the certification. It's the Certified Dementia Practitioners, which reinforces just the commitment to dementia friendly or informed worker. Knowledge is power. So her getting 90% of her team members certified, officially certified with this. And Brett, do you know how long that program is?
It's like an 8-hour program.
8 hour. So it's an 8-hour program, and then there's and recertify, and then I think they have to do some hands-on like practicing too. Yeah. So. Again, another metric that we're very proud of. And she's been completing these assessments across all of our communities, but this is like the biggest one, just to create more supportive, more dementia-friendly environments. We're working with our a couple of our architects for the arbor redesign, which I'll talk to you guys about that in a bit, just to see how can we improve wayfinding, or it's called like a wayfinding, some AI software. I don't know how much about it other than it's supposed to enhance the resident experience. Residents that have early onset dementia that have been clinically diagnosed, just so that they have some way to navigate through the dining, to the library, to this room. And she's working on getting a software or a program developed for that. I'm not going to read all these to you because I think I was told I only have an hour, and I want to allow for some questions as well. This one I can share with you. I know she's been working over the last year or so on expanding our community connections. We've got partnerships with the Winnebago County where Leslie sits on that I don't want to say board. It's a task force. Don't have to yell at me, Brett. She also works with the Anderson Japanese Gardens and the Rockford Public Library. And this isn't on here, but have many of you heard what the purple table concept is? No? So this is voluntary for restaurants to be part of this. If they decide to be a purple table restaurant, if you call them up and you say, I want to take mom, grandma out to dinner, could I please reserve a purple table? That says to them that you're bringing someone with some dementia, cognitive impairment that might be a little confused. So they have dedicated staff at these restaurants, so they put you at the purple table. I don't know if it's actually purple or not, I never asked Leslie that. But they have dedicated staff, tiny staff, that work and know, how to work with residents that need additional services. They might repeat their order, they might order twice or 10 times, so they're very patient. So that's something that Leslie's working with as well to try to bring here to the Rockford area. I don't know if we have a purple table restaurant here or not. I haven't caught up with Leslie. Is Jennifer here, Jen? Any update on the purple table? No? Okay. All right, to coming soon. All right, so now we're on our second initiative. They're gonna pull me out with the little. All right, so our second initiative, expand service reach and market presence. So we have 3 sub-strategies under here. Targeting a new geographic and demographic market, expanding programs and services to the middle market, and then evaluating potential opportunities for growth, which many of you already know. We've are well into that initiative as well. As you know, we are a faith-based Christian organization. We are here to serve, right? We're not for profit, and we're here to serve residents, all of you. Whether you're Wesley Willows, Peterson Meadows, Highview, whether you just live in Rockford and wherever in the Northern Illinois area, if we can help seniors that need our services, that's our mission. That's what we need to do. I can share with you that this is an initiative that Brett is leading right now, looking at other markets. You know, can we venture off into Rockton? Yes, we can. You know, we acquired Highview in the Woodlands last year, right? Many of you remember. So Highview in the Woodlands was in need of services. The residents in that area needed us. I'm happy to report that Katie Kinson is our director of Highview. Many of you know her as my former executive assistant, and she has done a fantastic job. Our goal was to be at 70% occupancy, and I believe she's really close to that goal now. She's right there, and that goal was as of June 30th, but any of you remember Katie, she's also an overachiever, so I'm sure she'll reach that milestone. And I do know that there is a need, so for those of you who might not be aware of Highview in the Woodlands, that is an assisted living memory care. It's licensed that way. About 36 assisted living and 26 memory care. We are now, Leslie has staff there, brain health and well-being specialists. We're conscientious of how we're wording it because the end goal eventually is going to be not to separate people with dementia. I know it's necessary because there's elopement risk, there's a risk of they need more care. Our industry's, one of the challenges that we have here that I'm sharing with my team members is how do we keep husband and wife together? How do we keep a couple together? You know, one of the spouses is in need for memory care and can no longer live independent. How can we keep them together? That's harder than it sounds, but as we know, sometimes the spouse that's caring for the other spouse with dementia, their health quickly fails because it's a lot of work. That's why you moved here. So we're trying to come up with programs and initiatives of how can we do better. I visited another CEO in Milwaukee, Wisconsin. Her community is St. John's on the Lake. She achieved that, and I asked her to invite me over there because I want to see how she managed to do that. There is no segregation of memory care, independent living, or other. And I said, well, you know, Renee, you've got the advantage because you're in a high rise, so if someone does elope, you can find them on another floor quickly. We don't have that. We are very blessed to have this beautiful setting here. So, you know, we're working on that. We're working on how can we do better? What can we do? And that's why we're looking at other programs and investing heavily in technology, which that's my other initiative. The expanding for potential opportunities for growth. I'm going to talk about the Rockton property. I made that announcement on Wozesta. Did many of you read that announcement? Oh, Wozesta's coming good.
Not as detailed as even WIFR's.
Yeah, well, I mean, you know, WIFR should have shared that after my meeting today here. I was supposed to be the one, but in all honesty, I do try to be as transparent with all of you. We have nothing to hide here, again. Try to share as much as we can, as appropriate, because, you know, then I got the calls, well, what are you doing? What are you building? I said, oh, I'll let you know in a minute, you know. I just know that it aligns nicely with this strategic initiative, potential opportunities for growth. So I will also share with you that the purchase was the former Goldie Floberg property. They donated that building to the village of Rockton. Mayor John Anderson called me and said the village isn't going to be able to do what they wanted to do. They were trying to bring in those, you know, their offices there. That building couldn't be rehabbed, and it was a lot of work. So he said, Francis, we would love for Wesley Willows to consider it. It's almost, I think it's about 7 minutes away from Highview in the Woodlands. So we said, oh, you know, I shared it with my board. My board's like, well, it's a pretty low-risk transaction. We're demoing the building. It sits on 10.5 acres, and part of our strategic initiative here is looking at expanding services up here, geographic and demographic markets, and potential opportunities for growth. We did do a feasibility study with Plant Moran about 3 years ago now, and we included that zip code, Rockton and Roscoe, and there is a big need for independent living there as well. So that's all I can share with you now, because I honestly don't know. It's not up to me entirely. I have to bring this to my board, and they'll give me the yes, build independent living, or no, just keep the land a little longer, and we'll decide what we do when we work on our next strategic plan in 5 years. I think I'm on my next slide. Oh, here it is. Okay, the third one. This is the third initiative, transforming the campus infrastructure and technology to support a smart, sustainable future. This one has 2 sub-strategies. One is developing a comprehensive master plan and infrastructure for our existing communities, specifically the Arbor. The Arbor is in desperate need of renovations, and I know many of you in this room agree with that. We're celebrating, I think, 60 years. So it's been open for 60 years. And I do know my predecessor, many of you remember Bill Pratt, he said it was on their strategic plan for a few years to renovate. He just didn't get around to doing it. And then COVID hit. And here we are 12 years later, and the Arbor is still not renovated or updated. So that I can assure you that we are moving forward with Arbor renovations. Now, we're working with our architects at Noker and Hall who designed this building. We're working with HKS, our design team, to look for innovative ways for spaces, for dining venues, for people that are in wheelchairs and have walkers. The Arbor residents, their acuity is a little higher with mobility, so we engage them to come up with a few ideas for that. And I do have some preliminary vision boards, but I haven't reviewed them all, so I can't share them with you yet. One of the other things that we're looking at is, and this is based on resident feedback from some of you, is improving or adding dining venues here to the independent living. We had talked about a possible coffee shop, and I said, I want to be as transparent as possible. Well, we shared that with you, and I might have shared that with you prematurely because we weren't sure what we were going to build yet. I had some of you, well, it's going to be noisy, and what are you going to do, traffic? I said, we're coming up with ideas we don't know. So as of now, it doesn't look like we're going to have a coffee shop there, but that doesn't mean we're not going to look at enhancing your dining experience here. what's great about this campus is we're not landlocked. We have a lot of land. If we want to build out, we can also do that. But a lot of that takes time, takes planning, takes money. So we need to be strategic about where we're spending our money. Right now, the big focus is on the arbor because it's been waiting for quite some time. Okay, enhancing technology and creating this, ooh, you went ahead of me there. You want to go back one real quick? Yeah, all right, oh, yeah. Oh, okay. So enhancing technology and creating a smart campus. Okay, you can go to the next one now. She can read my mind. She said we spend a lot of time together. She's not wrong. Thank you, Jenny. I said earlier, many of you have been using Wellzesta. Some of you are even our ambassadors. With Wellzesta, that ties in nicely with enhancing technology and creating smart campuses. We have Wellzesta, we have MemoMate, and earlier I shared that we have Motivacity for employee engagement. Well, Wellzesta, I can share some statistics with you here. We rolled it out in February, Brett, or was it January? End of February, okay. Well, we started here and we're here, and the resident engagement keeps on growing. We've got some numbers up there in case you can't read them. 252 residents are actively using Wellzesta. 41% of residents are actively engaged. 53 have daily check-ins. Are many of you familiar with the daily check-in feature? Yes, I encourage you to use it, especially if you're not feeling well. Please, and if you are feeling well, say you're feeling well. If you're feeling a little sad, say I'm feeling a little sad today. We want to be able to follow up with you in real time, okay? Star ratings, 4.7 out of 5 for the event quality, 4.4 out of 5 event impact on well-being. So what we're seeing here, resident satisfaction still remains pretty high, and engagement continues to grow. And I know Brett is really geeky about this because it's his favorite topic. Wellzesta, I think he once said, Wellzesta's my baby. So he even has a little button sharing his Wellzesta. What's the next slide, Jenny? I did that in 40 minutes. Thank you. Which means I have time for questions, and if I don't have the answers, I'm picking on my team members. You're not going to get out of this easy. Yes, Fern.
Is there anything in your planning, end-of-life planning?
The question is there anything in the current planning for end-of-life planning? I'm not sure, I know what you mean, but, Yes. So Fern was just sharing with me, someone he knows is the caregiver taking the initiative to gather all this together. This goes back to our integrated healthcare system under the different tiers. Where is Jessica? Jessica, can you share something about that the committee has discussed about including hospice or? Yes, yeah, come on up here. You could be, come on down, the price is right. Woo! All right.
Thank you for your question, Vern. So in case everybody didn't hear, it was regarding end of life and what kind of services are we going to be having put in place through the integrated healthcare system regarding hospice and other type of supports in that area. So that obviously is something that we want to look at. As Francis said, we don't have everything figured out yet as far as all the services and programs. But I will tell you that hospice is welcome in any lifestyle that we currently have here on campus. So we do have residents who are on hospice and independent living. We have residents who are on hospice and assisted living, and then obviously in our skilled nursing. So we have various hospice partners that we work with, and our resident services team and our social services team are very well connected with them in regards to whatever our residents need. I'll also provide you that resident services is very versed in helping individuals plan for or fill out power of attorney for healthcare paperwork and things like that. So if that's ever needed, that is part of our system now as well.
That isn't quite what I was thinking. A very practical things, like I live alone. And I have things I would, the toll-way system has an individual way and address my account with the toll-way system. And that stuff is not
So even more supportive services even beyond that. So maybe, Vern, I'd love to have a meeting with you separately so that I can really understand all of that that's included, but, sir. Yeah. Yes, absolutely.
Talking about and no one knows their pets. So how do you
Right.
know
Right. Fern, thank you for bringing that up. Thank you, Sue. And I'm just thinking if that's something that we can also add on some of our, if we can computerize that some way, like through use of our software, that'd be a great idea. Thank you for that. I appreciate that. Thank you. Yes, Lloyd?
I get
Remember your limits on questions, Lloyd.
confused as to how much is dealt with this campus versus the whole schmear. Like, the healthcare planning committee, did it have people from Peterson Meadows on it or not?
Now you gotta come back up here. The question, Lloyd, did the Integrated Healthcare Committee have residents from Peterson Meadows? I know the answer, but I'm sure he's gonna have a follow-up question for that.
So does it have committee members from Peterson Meadows? It does not. It doesn't, but we can always be expanding that, so it's a great idea.
Well, it relates to how much things are focused on this campus versus including the other campuses. And indeed, if there's further housing in Brockton, then it would include that.
Any other questions about the integrated healthcare system?
Just a question out of curiosity. Oftentimes, when you have a very exemplary plan of growth and expansion, but usually you oftentimes have to jump through multiple hoops set up by government, particularly the state, in terms of certificate of needs, which I heard no mention of that having been obtained, which you would be the very first layer of what has to be accomplished before you can even venture into these areas.
So the question was about certificates of needs and things like that before we're able to open up, say, like a clinic and things like that.
Or even to go into an integrated healthcare system, you would have to document.
Yep, and we're in the very first parts of building this out. I think Francis mentioned that this is a 5-year plan. So that is something that we're looking at as far as what do we need, what kind of licenses do we need. And as Francis said, we have professionals on our committee that have gone through this before, done this before, and so we're using our committee as a guide to help us through some of those things. But yeah, absolutely, we can't just open up a clinic, but we can engage with different partners on different things that we don't necessarily need occupancy of needs and things like that. So we're seeing what our need is on campus. That's our kind of our first stop, and so that's why you all got the survey. What do we need? What will you use? And then where do we go from there? And that's kind of where we are right now. Gail, is it for me?
It's about what you're gonna do with the healthcare, building. I know that the Arbor is going to get remodeled, the healthcare needs a lot of work. And where is it on the plan?
So Gail asked the question, what about the healthcare center? It needs some love as well. Gail, I was debating which one I work on first. So the Arbor was built 60 years ago, 1966, and then the healthcare was built in 74. So I had to address the one that needed the most care, but healthcare center is right up there. It's right up there. But remember, I shared earlier that we have 91 skilled beds for the healthcare, and we operate at about 70. So it's never full, because why? No one wants to go there. They want to age in place. For me, hi, Dennis, my buddy.
You've mentioned several capital expenditure projects, expansion, healthcare, arbors, the building here at the coffee shop. Do you have a 5-year or 4-year now capital expenditure plan? And can you prioritize that for us? You sort of just did a little now.
So I'm going to recap that if that's okay. Do we have the money for all this planned accordingly? And that's a great question. And Dennis knows I also have a finance background, so we do. We have monies earmarked. On average, this is a big organization, right? And it's a beautiful campus. So we had a lot of deferred capital maintenance that Bill and Deb just couldn't get to because of COVID and that. And I can tell you the first year, we had about $11 million in capital expenses that we, throughout the whole organization. So I like to budget. I like to know how much money we can earmark. And we've done pro forma statements, which was okay. For Highview in the Woodlands, we acquired them 1.5 years ago. An affiliation, you affiliate, we took on their debt, and our board of directors replaced their board of directors, and we just operated as usual. We did pro forma statements. Okay, what's the break even? How much money, is this worth doing? It's a great question. I'm glad that Dennis asked that, because before we delve into anything, we need to know, one of our core values is, fiscal responsibility. We have a responsibility to be prudent with the organization's finances. And I know some people call me cheap. I say frugal. I like to know what it is that, what's it gonna cost? Is it still worth it? And we'll go as far as spending money on having consultants do feasibility studies. If the answer is that's not a viable project for the organization, don't do it based on these metrics. So we have developed a framework with criteria on what decision is good, what decision is not good, before we even present it to the board. So if it passes the criteria, the financial screening, is it a good fit with does it align well with our mission? Is it going to continue the mission to serve seniors? And then how expensive is it and how much money is this gonna cost and when are we gonna reach a break-even point? So for some of these initiatives, for example, the arbor renovation, we already have a price for that. We have a capital campaign. The former VP, Jeff Ranke, kicked it off, and now our new VP of advancement, Natasha Shear. Over there, Natasha. She's continuing on with that campaign. So she hopes to raise $3 million. Woo, $3 million. You'll get there, to help defray some of the cost. And we have an idea I know how much we already have. To date, we have the big gala on May 16th. We're hoping to generate, open up the live part of our capital campaign. Right now, we're in the silent phase. Thank you. I got a thumbs up from Natasha. I got to get the verbiage, the terminology right there for the VP folks. So, that was a long-winded answer, but thank you for that question, Dennis.
I'm not sure you answered it.
Sue? How much debt? The question is, how much debt does Wesley Willows carry? 32 million? 30 million. So we have 30 million in outstanding tax exempt bonds. Do you have our journey report up there? Yeah. Our journey report that we share every year. You have it? It's not working. Okay. Many of you have seen it, but we, again, are pretty transparent. We share where we ended at the end of our fiscal year. And we also had, what's the organization? A.V. Powell and Associates. Are you familiar with A.V. Powell and Associates? They're an actuarial firm. We engaged them not too long ago. Just go to keep going. There it is, by the numbers. Here's our financial position. We have about a little less than 187 million in assets. Total liabilities about total liabilities and net assets about 186 million. These two even out. We have a little less than 67 million in net assets. That was up $5 million from the prior year. So we're very financially healthy. There's our just metrics like that. And I don't know, did many of you receive this? If not, where's Melissa now? Do we have extra copies of this in case some people didn't get it?
Yep, it's also
All right.
on the website.
All right, we'll have extra copies for you. Come just see Brenda and we'll leave them with her. Okay? Thanks, Jenny. Yes, ma'am. Are there any plans to update the gym equipment? There were. Natasha? Did we have a plan for gym equipment? I thought I saw something on one of your things with Jill, Coach Jill. I'm gonna say yes, but don't ask me specifically. I think she wanted an e-gym. Correct, an e-gym. So I know that she's looking to the e-gym. Now let me share though, any equipment that just needs to get replaced, that's part of our annual capital expense. That's part of our capital budget on a yearly basis. Brandon, where is he at now? All right, you guys gotta stand closer to him. He's back there. Every year, he works on our capital budget for the whole organization, and he drills it down to the fitness center. This is the equipment. This is the age of the equipment. To be safe, it needs to be replaced at year 7, but we're proactive. We usually do it a year before. So we want to make sure that any equipment that maybe doesn't last as long as it should, we immediately change it out. So yes, there is, but I know she wants this e-gym, which is pretty pricey, but we're raising money towards that. So, yes.
As you walk around the campus, you see crumbling curbs all over.
Brandon.
Sidewalks that are very scary to walk on because they're uneven. And a lot of us walk in the street because we don't want to walk on the sidewalks. And there comes over the sewer areas and squished
right, so the question was, now that, winter is behind us, we have some sidewalks and curbs that are crumbling. Brandon, are you aware of that?
Yes, we have a list that we're compiling and trying to do like one deployment of a lot of those, so we're working through that list for the spring.
Did you hear that response? Brandon says he already knew about that and he's got it on his list to take care of. Yeah. Number one thing is going to be safety and security. That's also one of our core values. Anytime that you see something like that, please bring it to our attention. I know that Brandon, his team, there's a QR code, there's Brett too. Any one of us, anything that's safety related, we will address immediately. Please, I encourage you to bring that up, okay? Any other questions? Yes, ma'am. Are there any plans to update the pendants? Yeah. Is that one of your capital items? Brandon, excuse me? Yes?
We're looking at new options.
Okay, do you want to elaborate more?
I don't really have any more information other than it's a massive project and we want to pick the right partner and we're gonna make a change.
Yes, Brandon?
The current pendants do locate, was that the question? Locating?
Hi, what was the question? I'm sorry. There was something specific though. Okay, the question was, are we gonna update pendants because the ones we have now don't tell us where they are? That's not exactly true, they do locate. If you press your pendant, it triangulates and tells us where you're near with the repeaters. So our current system does do that. Yeah, but we can double back and check on yours. Yeah. But as Brett did mention, we are evaluating the whole system and looking at a couple of different providers for that. So there very well could be a new provider down the road. Okay.
Thank you. Hi, George. How are ya? I beg your pardon?
Anything to reduce our environmental impact? Solar panels, vehicles, garden care.
The question is, are we doing anything to reduce our environmental impact? For example, electric, solar panels. What was the other thing? So, no styrofoam. I'm with you on that one. We have been looking at that, George, for some time now. We've been, we being Brett, Brandon, and myself, we went as far as a meeting with some companies that offer either solar panel. We are blessed to be have all this extra land, so we were contemplating that. There's regulations and there's rules to follow. We were also looking at electric vehicles as well. Again, as Dennis says, everything has to be budgeted. There's a cost to everything, and it's like which one takes priority. Arbor, healthcare, we want it all. We're going to address it all, but we have to be strategic about how we, rate it in order of what should we really address first. Again, safety is going to always be number one. Drop what we're doing. If it's a safety concern, we will address it immediately. The routine maintenance is going to always be part of our ongoing plan here. And any new initiatives like solar panels, like EV stations, and that's a wish list. It's on there, but in order of which one should we take care of first? It's a little below the other two initiatives. Hi, Denise.
With all the issues and things that we have here, Iron, Westfield, Rollins, there's so many things that are pending, we're going to do this, we're going to do that, that I don't understand how we go out on my property, we need to have work done
So the question is, why did we go buy Rockton when there's so much that has to be done here? Okay, so Rockton, the property, the mayor sold it to us for 80% of the fair market value. So, yeah, it was sold to us for $400,000. This was public knowledge. I think this was in part of that news article that came out. So it was a relatively low risk transaction where if we turn around and sell it, we make a profit on that. And we are also, we just shared, Denise earlier, the financial status of Wesley Willows. Now, if we were to address every single thing, it wouldn't be good use of, it wouldn't be financially prudent for me to do that. We do have to budget it out accordingly. And I think, I shared earlier, the first year we spent like $11 million just on capital, deferred capital expenses that weren't done, finishing, some of the buildings that were new. So we are being strategic about what we, deem as this needs to improve. And sometimes you have to spend the money, especially at the Arbor. And I had a lot of heads nodding over here. That building was neglected for so many years, and that's a priority. So, sorry, Denise. I saw another hand, yes.
My question is for expanded campus services. Before COVID, we were able to get housekeeping in the homes, and after COVID, they stopped that because they weren't enough housekeepers in-house. I was wondering if there's any thought of getting services provided, outside services, maybe that.
So the question was, before COVID, and I wasn't here before COVID, so I wasn't aware that they were going to your house to do some housekeeping. During COVID, that stopped, so we no longer sent our housekeepers there. And the question is, should we consider opening that back up? I don't see why not. Who from my team wants to break that one down?
It's already written down.
Oh, thank you. Brett's on it. Well, we can easily look at that. I don't see the king coming out yet, but it's 4:00 now. I will hang out a little bit longer, but I want to be respectful of your time as well. If I didn't address your question to your satisfaction, please come see me afterwards. I will be up here. And I hope this was informative. Is this something that you would want me to continue to do?
Yes.
Thank you, Ken. Thank you. Okay. Yes, Ken.
I think it would be great. Today you dumped a big load. And it's going to take me a while to sort through some of it. I think it would be helpful periodically, I don't know if monthly is workable, but every couple of months, little pieces of the stuff you're talking about that keeps us informed of what's going on would be nice to hear about before you spend the $400,000.
Right. So, Ken, I appreciate that. I can't do this on a monthly basis because I don't think the information would really change on a month-to-month. But Sue, thank you. I think it's a great idea. A quarterly basis, we can look at that. We can look at a quarterly basis. I was thinking at least twice a year, but we could do it every quarter. if you want.
More
All right. Just for you, Ken. All right. Thank you, everyone. Have a great evening.